thank you everybody for joining us tonight for this presentation. We're excited to talk to you all a little bit more about a postdoctoral training opportunity available here at Yale for chiropractors, specifically chiropractors who are really interested in getting into the policy space. This is a postdoctoral fellowship called the IMPAACT Fellowship, and IMPACT stands for Innovations in Musculoskeletal Pain Administration, Analytics, and Care Training. If you haven't heard about postdoctoral fellowships before, they're a little bit more common in other professions, but they do exist in the chiropractic profession. It simply is what it sounds like. It's additional training in a particular area of expertise following your doctoral degree. So a lot of people do this, PhDs in certain research realms. It doesn't just have to be research, and this is one such opportunity available for chiropractors, and it specifically relates to policy. So I'm sure all of us here know how important healthcare policy is for our patients first and foremost, but also for the chiropractic profession. So policy positions are important, but you may need additional training as a chiropractor in order to obtain some of these positions. So that's where this particular postdoctoral training program comes in. So the mission of this particular fellowship is to prepare chiropractors for future careers in healthcare policy and administration. So the focus is obviously on non-pharm approaches to musculoskeletal diseases. It is, the training occurs at the Yale Center for Medical Informatics, which is part of the Yale School of Medicine, in conjunction with the VA Connecticut healthcare system. So it's based here in the New Haven, West Haven, Connecticut area. Okay, so there are many facets to this fellowship training, and a fellow does wear many different hats. Some of the things that a fellow will engage in during their training here is working on multiple health policy projects, and also engaging in one, if not more, independent research projects under the mentorship of more senior faculty. One of the newer additions to this fellowship program that we're really excited about is that the fellow is concurrently enrolled in a Master's of Public Health degree program here at the Yale School of Public Health. This just started with our most latest fellow, Dr. Sarah Graham, so she can talk a bit more about that later. And fellows who obtain clinical privileges may spend up to 15% of their time in patient care. This occurs at the VA Connecticut healthcare system. A few details about the program. So it is 2 years and it's full-time, and it is in person here. The program director is Dr. Anthony Lisi. Dr. Lisi is a researcher here at Yale. He's also the program director of the National VA Chiropractic Program. During the fellowship years, fellows receive a stipend that is based on the National Institute of Health's norms for postdoctoral fellows, and it's based on your PGY, stands for postgraduate year. So you can look these up online, see how far you are out from graduation, what that number would be, but the current range for this year is about 55K to 66K. As a Yale employee, you will receive health, dental, and vision benefits. You can also contribute to a retirement plan. And if you're interested in going for the Public Service Loan Forgiveness Program, Yale is one of the qualifying employers for that. So your 2 years in the fellowship would count toward your 10 years of public service for loan forgiveness. In order to be eligible to apply, you need to have your chiropractic license in any state by the start of the program. So for this upcoming program start, which will be in August of 2023, you need to obtain that by July. You must also be a U.S. citizen or permanent resident, and you would be concurrently enrolled in the MPH program, and tuition would be covered for that program. So we accept a fellow every 2 years for this program. This upcoming August would be the next fellow start date. If you are potentially interested in this program, would like to apply, you need to know that the deadline is by the end of this month. So please keep that in mind. You can follow the link for more information about the fellowship and how to apply, or simply Google Yale IMPAACT, it'll bring you there. But basically, in order to apply, you would need to get a CV and a letter of intent in by the deadline at the end of the month. And this fellowship is very generously supported by the NCMIC Foundation. Okay, so now moving into some introductions, we wanted, all the former and our current fellow to talk a little bit about our experiences in the fellowship program. So first, to introduce myself, my name is Kelsey Corcoran. My picture is on the left. I am currently the chiropractic program manager at VA Connecticut's Prime Center, which is a larger research center. They do a lot of data analytics. I'm also an associate research scientist here at the Yale School of Medicine, and I started my IMPAACT fellowship in 2017. Dr. Ryan Burdick also completed the program. He's currently the lead analyst for federal policy at the Maryland Department of Public Health and finished up his IMPAACT fellowship in 2021. And our current fellow, Dr. Sarah Graham, obviously currently in the program and concurrently enrolled in that NPH program. So she can speak a little bit more about that. So we wanted to start off by kind of giving you all a little bit about our personal experiences, both thinking about applying to the program, what we did in the program, and then afterwards for those of us who went through it already. So we first wanted to start by talking about what we were doing before the fellowship and why we considered it, why we applied and were interested. So I'll kick this off. I was a Western States grad, and I started the fellowship. There was over a 1.5 year gap between when I finished school and when I started the fellowship. In that time, I did complete the 1-year VA chiropractic residency program. I did mine at the Buffalo VA, and I was able to do a couple smaller research projects during that time, looking at patient outcome data that we manually extracted from the charts, a very small scale research project, but it was good exposure for me. So when I first heard about the fellowship and, big data, such a buzzword, and a lot of other healthcare professions benefit from having people with expertise working with large data sets, processing them, and then ultimately using them to prove their case for various initiatives. So I was really enticed by this idea of learning how to work with big data and being able to get some of those skills personally. Dr. Burdick, you want to talk a little bit about your experience?
Yes, I'd love to. Good evening, everyone. My name is Ryan Burdick. As Dr. Corcoran mentioned, I was the second IMPAACT Fellow that was from 2019 to 2021. First off, it was a great experience. And some of the things that really brought me into understanding that why I might want to pursue a fellowship was due to the fact that in college and undergraduate degree, I was a little active within politics and then just leadership. And then as I got into chiropractic college, I went within my first semester to the American Chiropractic Association's advocacy conference in Washington, D.C. And at that point, I really started to be very interested at the intersection of where healthcare providers can inform a larger conversation of how we are going to improve and change our healthcare system. as I went through my chiropractic education, I continued into that. I actually got into national leadership within the student ACA. But then also, aside from just advocacy, I did 2 internships that I think were pretty pivotal to me deciding whether I wanted to be an advocate that was a chiropractor or whether I wanted to be someone who actually works in policy. And those experiences were I did an internship for a mayor candidate race whenever I was in Kansas City. And I wrote a policy position on opioid use and how to prevent that at the local level. And that was kind of my first step within the larger space of policy. And then after that, I also did an internship within the Kansas state legislature. And I think those 2 positions, as I was nearing graduation, really, really attracted me to, I do want to pursue this as a career. And that there is a lot of value in healthcare providers being active in this space. But I also knew that I needed more training to really do the job that I wanted to do. I think the best way when it comes at the intersection of health informatics, which is a simple definition is using data to inform policy, you really do need to have an understanding of how clinical data can improve the broader health space. And if you do have the data, you can support change throughout that. And within our American healthcare system, there is a lot of change needed as pain continues to be a problematic and expensive disorder within the health system that really brought me into where I'm at today. Feel like I could go on for a while, but I'll turn it over to the current Impact Fellow, Dr. Sarah Graham.
Thank you, Dr. Burdick. Hi, everyone. As Dr. Burdick said, I'm Dr. Sarah Graham, and I'm the current Impact Fellow. My path to the fellowship was a little bit longer. So I graduated from Cleveland University in 2017, after which I volunteered with World Spine Care for about 6 weeks in Botswana, then came back and was in private practice until I began the fellowship. And I think when you have the opportunity to be in private practice, that's really where the rubber meets the road when it comes to what you can and cannot do within the healthcare space. And so for me, I was very involved with the Student American Chiropractic Association in school. I was a big advocate for the Medicare parity, still am. And so that was where I first really began to realize like how chiropractors, in my mind, should be incorporated within this larger healthcare arena and not just like boutique or fringe healthcare or anything like that. I think there's a lot of value in what we as a profession can provide for people experiencing pain or other types of, ailments. So when I started private practice, I still am, and to this day, I'm still a really big advocate for taking insurance. I think it's a big way that people are able to access our care. And one of my bosses at the time made a comment about how, oh, well, we don't want to treat Medicaid patients. That's not the patients that we want. And it always really sat poorly with me thinking about that. And I've always been the type of person that wants to know why. And so I wanted to know, like, what is it about this system that isn't working? Why isn't it working? And what can be done to make it better? And so once COVID happened, my where I was working shut down and contracted. And so I did not have a job once the shutdowns all happened in Massachusetts. And during my few weeks off, I had started looking at MPH programs in other places because, again, just these questions I kept having about like, well, why is it this way? Why can't it be different? Why can't we have parity? Why? I couldn't satisfy my answers on my own. And so I had started looking into things. And then I'm really very lucky that I knew Dr. Burdick during school. And so I started like asking him questions about the Impact Fellowship. And is this something that could work for my personal goals? I wasn't sure I wanted to stay in private practice for the long term. Even when I was in chiropractic school, I always thought that I wanted to do something a little bit broader. I like big pictures and I like big systems. So it was really a great fit for me in that regard. I'll talk about the MPH program later as well, but I can't speak highly enough about the training that even that alone gives you, but the addition of being able to work with these other chiropractors that are at, the VA Connecticut system doing this type of like health systems research truly is a one of a kind opportunity. And it's been incredibly eye-opening. I've learned so much in the past year and a half, and I am so sad that my time will be coming to an end next year, but we'll talk a little bit more about that stuff later. So
We'll be sad it's coming to a close too, soon too. So thank you for that. Next, we were all going to talk a little bit about our experiences within the fellowship, and for myself and Dr. Burdick, what we did after that training. You know, what projects that are taken on during the fellowship is always a combination of, you know, what is happening at the time, you know, what you happen to fall into during your 2 years of the fellowship. And it's also driven by your own personal interests, which happens in a lot of fellowships. A lot of it's very self-driven by the particular fellow. So I couldn't have anticipated at the time, but in the middle of my fellowship, which ranged from 2017 to 2019, the Appropriations Act of 2018 was passed, and that mandated expansion of chiropractic services within VA. It mandated both the expansion of the number of clinics that we had nationally, and it also included chiropractic services as a preventive healthcare benefit to veterans. So this was really great to see unfold during my time as a fellow, the response to this, how VA started to expand chiropractic services and offered more clinics, started to analyze to put forth the best response to VA now having chiropractic services as a preventive healthcare benefit and how to best implement that. Another thing that I worked on was VA is incredibly large. It's the largest healthcare system within the US, has a lot of healthcare disciplines, obviously, and offers a ton of CE. However, there was no continuing education opportunities available to chiropractors within VA that was accredited. So during my fellowship, I work with both VA and PACE, the Federation of Chiropractic Licensing Boards, PACE program, which is their accrediting body, to start to get CE accredited and available for chiropractors within VA. I also worked on a number of research projects during my time as a fellow, but the one that was wrapped up during my fellowship training and that I was first author on was a systematic review and meta-analysis of the relationship between chiropractic care and opioid use. That manuscript was published in Pain Medicine. Other things I did during my time as a fellow, I did engage in clinical care. There's a very robust chiropractic department at the VA Connecticut healthcare system. And I did something a little bit different during my time as a fellow. We started a smaller chiropractic clinic embedded within women's health at the VA in West Haven, Connecticut, to try that model out, work with different providers, and see if we could reach different veterans that way. And I was also able to audit some coursework at Yale during my training. Following the fellowship, I obtained the positions I am still in now, which is the chiropractic program manager at VA Connecticut and associate research scientist here at Yale. One of the main things I do as part of my job is I offer operational support for VA's National Chiropractic Program Office. I manage a data analytics team of programmers, statisticians, chiropractors with medical informatics expertise. We work on analyses and projects for the National Chiropractic Program Office. We create data dashboards. We answer kind of as needed data questions as they come in. I also collaborate with the program office in supporting the implementation of new VA chiropractic clinics. For many years now, we've had an annual multi-million-dollar budget in order to help start new chiropractic clinics at VAs throughout the country, also help expand some existing ones. That's been incredibly rewarding to get to work with facilities to hire their first chiropractor and start their first clinic and really see that take off. I continue to stay engaged in health policy initiatives related to VA preventive chiropractic care and the analyses about how to best implement this for veterans at the VA. So that's high level, a lot of the things that I do currently. And I'll turn it over to you, Dr. Burdick.
Thank you. As I start mine, I want to highlight something that Dr. Corcoran mentioned of that each fellowship is different. I think you're going to hear that said by each one of us. And it is because we have different backgrounds, different experiences, as well as different desires to do after the fact. So as I kind of mentioned in the earlier statement, I'm really interested at the intersection of politics, policy, and healthcare. So my fellowship focused within those realms to set me up for future positions. Within that, I was able to, probably 6 months into my fellowship, it was the start of the pandemic. So I had 6 months in person, and then the rest was kind of a remote status type of thing, as we all were. And that definitely threw some complications, but I actually think it turned into a lot of positives as well. But within that time frame, I did work within the VA program office for chiropractic to write 2 policy analysis for the Senate and House VA committees that would ask for more appropriations for chiropractic expansion over the next several years. So that was a really good experience. As you try to get into the policy space, it's really important that you have actual tangible things that you've either written or collaborated on that you can turn in with your application to future positions. So that's one more reason why like this fellowship is really important, because it will equip you for things down the road that you might not know that you need quite yet. Another project I worked on had to do with the federalization of the scope of practice for chiropractors within the VA system only. So a lot of this was a lot of analytical work and regulatory analysis of state practice laws across the nation, and then trying to make recommendations on what that should look like long term within the VA. And that was some federal rulemaking that kind of caused that. Another thing, as COVID started to happen, and because I, once again, do believe that healthcare providers should be at the forefront of policy within the healthcare space, I did volunteer to serve as a healthcare fellow within the United States Senate. And this was in response to COVID. And my specific focus was on how health disparities impacted and were magnified during the pandemic on certain communities, with a, I guess, appreciation for the state of Connecticut, because that's where I was living at the time. So I was in the Senate for about 6 months, and it was a really good experience. I was able to learn a lot about how policymaking works at the federal level, as well as from a legislative perspective, which was really key for me as I was trying to determine what I wanted to do long term. Obviously, there is a research component to fellowships, and I was able to do, using VA administrative data, was able to complete a paper that was an update of a past paper that was done that really detailed the expansion of chiropractic care within the VA over 5 years. As well, I was able to present that at conferences and then actually get it published within the Chiropractic and Manual Therapies journal. I think it was earlier this year, actually. And all of these positions really set me up for kind of where I'm at now. So currently, I reside in Washington, D.C. My partner's job is here, so we relocated, and I ended up taking a position within the Maryland Department of Health, specifically within the Office of Healthcare Financing, which is the Medicaid Policy and Program Office. This is a really interesting position for myself. I've enjoyed it for the past year. And I think some of the things that they really were attracted to from my application was that the fellowship prepared me directly for this position. Most of the work I do is at the intersection of health data, outcomes, research, and policy analysis, as well as being able to write and work on a team environment. And a lot of that is what you'll get if you were to apply and be selected for this position. I've been there for just over a year, and now I recently was promoted to be the lead analyst for federal policy, where really the major focus is how federal regulations and updates from CMS and HHS can then be dwindled into the state. A lot of this is very complicated. If you are new to the policy space, I could give about an hour presentation on Medicaid 101, but we don't have time for that tonight. But feel free to email me, and I'd love to talk with you about it. But Medicaid is extremely important. It's not just a health insurance company that some people think it is. It really is very innovative. They work at trying to get down to the root causes of a lot of the health conditions. It's very similar to some of the things that chiropractors say, or you learn in chiropractic college, of getting to the root causes of things. Medicaid policy is similar in that we actually do work with social determinants of health. We work with housing policy and nutrition and all of these other things. And it's a partnership between the state government and the federal government to provide better treatment for individuals who are mostly low income, or depending on your state, lower income, or sometimes left behind. It's a really important thing for moral as well. And it's a great place to be in if you're interested in policy to look up in the future. Also, during my fellowship, I was able to write a position for the Connecticut Chiropractic Association, advocating for the coverage of chiropractic and acupuncture services within the state Medicaid system. And then I was able to meet and speak with members of the state assembly to end up having that pass about a year later. And once again, all of that was because of this fellowship. So I think that was a pretty good recap of my fellowship time. Feel free to take it away, Dr. Graham.
Awesome. Thank you. Yeah, so the reason that chiropractic is included in Medicaid is in large part to what Dr. Burdick said, in the state of Connecticut. So I talk about policy a lot. That's like what I really love. And I think it's because Ryan hit the nail on the head when he said, we are taught this paradigm in chiropractic school, like, oh, well, we want to get to the root cause of things. We want to know why things are the way that they are. And policy does that, but to a larger extent, the MPH program does that as well. So most of what I'll talk about will be that, just because I feel like that's the thing that's a little bit different about my time compared to Dr. Burdick and Dr. Corcoran. So yes, I'm doing some research at VA. I'm doing some health services research projects. It takes up a large part of my effort, but the majority of my effort is with the MPH degree. And through the MPH degree, we're taught about how to pull levers to affect change. And that's something that I believe is truly an invaluable skill to have in this space. Going to Yale as well, I've had teachers tell me this in the past at school, and I think it's true, that doors open to you when you become associated with such a world-class institution that you would never imagine. And so there's not really a floor to what you can do. It's all about like, what's like the next best thing. There's not a ceiling, I guess is what I meant to say. But some of the interesting things that I've been able to do thanks to the MPH program is some practicum experiences. So I work directly with Connecticut State Senator Dr. Saud Anwar. He is a pulmonologist and also a state senator for East Hartford, West Hartford, and a couple of other places. But when I was with him, I was doing policy briefs. So learning how to write something, like Dr. Burdick said, having that written work product is really critically important. I helped him with policy research, comparative policies, especially when it comes to state level things and initiatives. A lot of the work that you do is seeing what other places are doing. In addition to that, over the summer, I worked as a fiscal policy intern at the State House in Massachusetts. And so there I was working in their budget office, helping again with like doing policy analysis work, comparing what Massachusetts was doing. And Massachusetts budget is in the billions of dollars. So really seeing how the impact of your budget really makes an impact for everything. If there's not funding for it, it's not going to happen. And so that was very interesting, especially because thanks to the public health emergency, there's a lot of extra money in state government right now. And so there's a lot of room to be very innovative in healthcare spaces, especially. And so I'm sure Dr. Burdick has been dealing with ARPA money and like all of these things that are allowing places like, I know Massachusetts for sure, to do things with social determinants of health, like housing programs like Dr. Burdick had mentioned. So there's so much more to healthcare than just pain and just your body. There's so many more aspects to it, those upstream causes. And the MPH program really equips you to look at the world and see like, oh, this is a public health thing. Like this is something that a public health professional should be looking at and attacking. And having the clinical background and being able to be, you know, a clinician in this space, it gives you such a leg up for understanding how it works. Again, like when that rubber meets the road and when you're in that day-to-day thing, being able to speak to not just, you know, these policymakers, but you can also speak to the clinicians. You can speak to the people that work in these hospital systems. You can speak to the chiropractors in the field, and you can understand a little bit about what they're feeling and what they're, you know, discussing. And that's a really powerful position to be in. And that's a big advantage for being a clinician in this space. And then finally, this semester, I'm working as a Medicaid policy intern. I could talk to you all for hours, just like Dr. Burdick, about the importance of the Medicaid program. I think it is the coolest thing. And in that, I've had direct meetings with the Medicaid director of Connecticut, and to be able to sit in a meeting with the Medicaid director and to say, oh, hi, it's nice to meet you. You know, I'm Sarah Graham, and him say, oh, I've heard about you. Your teacher told me to look out for you in this internship and said, you know, X, Y, and Z things about you that are positive. It's a really cool thing. And it speaks to me to the environment of YSPH, so the Yale School of Public Health. It's a small school. Your cohort's not very big. So there is that like intimacy factor where you can be in class with your peers, really get to know your professors, and then have these experiences like talking directly to the Medicaid director and saying, hey, this is the policy that I think you should go with. This is how I think we should include this, you know, CPT code within your telehealth SPA, which is the state plan. I can't remember what the A stands for, amendment. And for them to take you seriously, right? Because you have something to say and you have an idea of what's right and you've done your research and you can just say, hey, this is my opinion. And then they can ask you questions about it and you can have that conversation. So the classroom experience has been beyond fabulous. The practical experiences are incredible, like nothing I've ever had in my life. I can't say enough great things about the program that I've been able to experience. And the classroom experience as well. I wanted to mention that at YSPH, you can take classes, not just at the School of Public Health, but you can take classes at Yale Law School. Some of my favorite classes have been at the School of Management. Healthcare strategy is an incredible class, and it's taught by a really awesome person who does really crazy, awesome research in the healthcare space. And so to be able to sit there and listen to these brilliant minds discuss these things, I mean, it's overwhelming sometimes, but it's just the greatest experience. And it makes you like, I was talking to Dr. Lisi about this after, so the first ACRAC I went to and I presented and I was like, okay, I have an idea of what's going on. But then even getting ready to like do my second ACRAC, just the level of thought and my ability to say like, oh, hey, like actually this is a research question that should be asked. It shouldn't be asked in this way. What if we asked it in this way? And oh, hey, what if we analyzed this and did this type of linear modeling on it instead of this type? But if you don't know that information, if you haven't been exposed to that, because we're not exposed to a lot of that stuff in chiropractic school, which is fine. It's not what chiropractic school is for. That's what these impact fellowships are for. And I could go on, but I do want to leave a little bit of time for questions with you all. So if you have any specific questions about any of our experiences, the research that we're doing specifically, what you might need to do to become a good candidate, anything like that. I know I can speak for myself, and I would assume also for Drs. Corcoran and Burdick, but we're open books. This is such a great experience. And I wish I could, the joke is I would just apply again, but I know I can't. I have to move on and spread my wings, but it's a great time. And I think anyone that gets the opportunity to do it is a better person for it.
I agree. So as I mentioned earlier, if you have any questions, feel free, you can put them in the chat, or if you'd like to, feel free to, raise your hand on mic and take it away.
Yes, and if you think of anything at a later date, please do email us. I'm sorry, was someone trying to speak that I talked over?
Yeah, I thought it'd be the first one. I'm Jane, by the way. Sorry, I don't know why my camera isn't working on my computer, so you're just gonna have to look at my block. So yeah, I'm interested obviously in this program. I think it's a great opportunity. So how would one, become a good candidate for this? Like me personally, I don't have any background in research or just that I just didn't have an opportunity for it, I guess, while I was going through. So how would someone like me with my background become a good candidate?
Yeah, I'll start. Thanks for joining us tonight. I think you might have heard that a lot of our backgrounds were very different. So don't feel like you want to copy any of us, but as you go through the application, and there are some documents online that kind of go into more detail of like, this is the Impact Fellow. Here's some strengths you should have if you're wanting to be a strong applicant. Definitely go through those, and then self-assess where you fit with those, and then put your best foot forward. And honestly, I would say even if you don't get this position, but you still are interested in things like this, to apply and give it your all from now until the position starts. You'll never know. Like, I didn't know this position existed as I already did policy work, because I was like, I think I want to do this with my career. And I just got really, really fortunate. And, once again, grateful for NCMIC Foundation for funding this, because this fell right into my lap. I found out that I got the position a week before I graduated. So like, it really is like, set yourself up to be a really strong candidate or applicant. And then, whether you get this position or if there's something else available, you will be thankful that you put the work in, like in the past, because you don't want an opportunity to, pass by and you're like, oh, I really wish I could have done that, but you never had the checkpoints to be a strong candidate. I don't know if that really answers your question. Feel free to take a stab at it as well, Kelsey and Sarah.
Sure. I mean, it's a great question, and it's especially great for for anyone, even if you're interested in August, or if you're thinking about this years down the line. If you do look on the website, the preferred qualifications say people with some experience in either healthcare policy or data analytics or research, things of that nature. People often come to me with that list a little intimidated, because they assume that they have to be the best at all those things. And that's not the case. We don't expect somebody to come in like that. You can be creative about how you might get some experience in one of those realms, but I think some of the typical things that are available at a lot of chiropractic schools, and I know how busy a chiropractic program is, would be things like getting involved with SACA, or like getting involved with a journal club or a research club, just to get a little bit more familiar with research. So those are some of the more common options that I see at some of the chiropractic schools.
And I'll say, I don't want to be a researcher. Like, that was never something I wanted. I would not have touched a research club with a 10-foot pole in chiropractic school. My angle in this, and the way that I feel like I was able to set myself apart a little bit, I have a background in writing. So my bachelor's degree is in English. So writing is a really key part of any kind of job like this. And I, even in classes, like most of my finals are papers. So the ability to research and write, I think, is critically important. Not research like clinical research, but like reading policies or reading whatever, and like creating a work product from that. And I was really involved with the state association after I graduated. So I was with the Massachusetts Chiropractic Society. I was on their board. I was like the only person under 50 and the only female that was on the board. But I did that. And I think that that was really positive for me because again, they're doing a lot of like, you know, how does this affect chiropractors specifically? But just trying to get involved in that way, I think was more my drive for things because like I said, I don't ever want to be a clinical researcher. That was never a goal of mine. And I think when you're looking at applying to things like that, self-assessment and kind of like what Dr. Burdick was saying, knowing what your personal career goals are is so important because it's like dating in that your goals have to align with the goals of the program. Otherwise, it's going to be uncomfortable for everyone. Like you're not going to have a good time. It's not going to fit with your like hopes and dreams. And the whole point of this is to like nurture someone's like big goals to do this type of work. So yeah, I think that's what I would say to that.
Thanks for the question. Does anybody else have anything, either unmute or put it in the chat? As we give it just a few more seconds. Ryan, Sarah, was there anything else you wanted to touch upon? I actually had wanted to mention you didn't need all those qualifications of the preferred experience, you know, that sometimes throws people off. Was there anything else you thought of that you wanted to tell this group?
I would say just the informal life advice, whether it's related to this or not, is to really have good mentors that will be able to tell you about opportunities that they think you're good at, and to have them actually know you and invested in you. I think that's super important. I was very blessed to have multiple people that were like, hey, we think we know you pretty well. You've done this at, you know, SACA or anything. Are you interested? I had like 4 people email me about the fellowship like right when it was announced because they knew that I was interested in like health policy. So I think that's really helpful. One more thing about the program, and I think Dr. Graham mentioned it, is that the cohort there is incredible. They're very supportive. I am from Arkansas. I went to school in Kansas City and I moved to Connecticut, and it was worth it. Really intellectually driven, and you'll grow a lot in how you communicate with either colleagues or superiors. So I can't stress that enough. That's a really important skill and something that if you are trying to get into this space, you probably will need some practice with. But
I would just like to do a little plug for New Haven. It's a great town. The pizza's great. The food is actually quite good. It's a quick train ride to New York City. It's easy to drive around. It's easy to get to. It's by the water, the ocean, the Long Island Sound, which to me is ocean enough, being from Missouri. So yeah, I mean, it's a great place. I really love it here as well. And I did want to mention that little plug for the area.
Awesome. All right, well, one last moment. Any questions from the group? All right, I didn't see anything come in the chat. Thank you so much for joining us tonight. Just a final reminder, the deadline for this upcoming fellowship cycle, which will start in August, is the end of this month. So don't forget that. This will be recorded and posted to the IMPAACT Fellowship website if you want to reference it later. But especially if you want to circulate it around your colleagues and peers, help them know about this opportunity too. Please help us spread the word. All right, thank you all so much and enjoy your evening.